Okay, everybody's got to bear with me tonight as I get used to my new glasses. I can see you guys. So
But she looks really cute.
Aw, thanks, Linda. Okay, I would ask everybody to rise so we can do the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all. Linda is going to read the mission statement. Linda?
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provide quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Linda. And I'd just like to take a minute and say welcome to our new board member, Wayne Connor. So welcome. And congratulations to everybody that got sworn in tonight. So fun night.
You can move down here if you want. As you learn the acronyms, you can move closer.
Okay, moving on to number 3, adoption of the agenda. I'll take a motion. Motion by Donna, support by Megan. I can see you guys so much better now. Okay, all in favor?
Aye.
Any opposed? 4, hearing of the public. Is there anyone from the public that wishes to address the board? Going once, going twice. Close the first hearing of the public. There will be a second one at the end of the meeting. We'll move on to item 5A, request to approve. I'll take a motion on 5A, request to move to CMH full board for final approval, TBD Solutions contract. Just so you guys know, this did get legal approval this morning, so that will be reflected on the full board meeting.
Move to approve.
Support by Linda, support by Selena. Dave, I think.
Yeah, we did issue an RFP for crisis stabilization services. There were 3 respondents, and only one submitted one specific to a facility-based. The other were mobile. And we realized that we'll have to probably resubmit that. I'm trying to get an update from Christina on where we are. But we did also tour the Juvenile Justice Center with the Michigan Department of Health and Human Services. We are part of their crisis stabilization pilot. We will be receiving $100,000 for being a participant in that. And I really want to do this right as we move forward with the crisis. They're calling it a crisis and receiving. TBD Solutions has unique experience in this area. Jason is the point person, and there's actually a crisis stabilization agency program group that he runs. They've helped set up other programs nationally. They are based here in Michigan, but they do work nationally. So what I'm asking for is approval to enter into the agreement, and then we'll use them kind of as needed as this project moves forward. But they'll help us make sure we're doing things correctly and to the best practices as we move forward.
For Dave, Selena.
I don't have those details handy, but we'll be able to control the utilization as we go forward. I'll have that detail for you for the board meeting, ahead of the board meeting. We're also working with TBD through the Michigan Consortium of Healthcare Excellence, so I'm getting my contracts are overlapping. about scope creep?
Any other questions or comments? Motion and support, all in favor? Opposed? On to item 5B, request to move to CMH full board for final approval, MCCMH Mental Health Matters Awards. Estimated expenses not to exceed 25,000. I'll take a motion. Motion by Megan, support by Donna. Tracy, Dave, who's taking this one?
I'll punt this one over to Tracy. You're on.
So just a reminder, this is occurring on May the 18th. It's at the Macomb Community College, the South Campus. We're estimating it to be lower than 25,000, but we are just putting that just in case some additional items that we've added recently as a photographer. So we're very excited that when upon people arriving, they will be greeted by the mobile unit and sparkling water, and then they'll be entered and they'll have a photographer with a backdrop, take their picture and then go to registration. It is a dinner event, and we're serving appetizers and just a main course called Pastabilities. So I'm happy to answer any detailed questions if you have any. I appreciate Laura meeting with me, and I know several of you have done some very specific efforts, so I greatly, greatly appreciate what we've already done. But I'll still say we still need more nominations, and we also need some additional attendees that we want to make sure are participating. So anything that you guys can do, we would greatly appreciate. It is free. That's what this request is directly covering. There are being donations of like baskets and things like that, but the cost would be to cover the actual event.
Tickets.
The preference would be no later than May the 15th, which is that Monday, if somebody was doing like a basket or something, just so we have a good count of what that looks like.
Can we make donations?
Absolutely. If you look at the partnership opportunities that I shared, I just made suggestions. There's really not a right or wrong answer, but where our hope is that we have a number of baskets, iPads, laptops, anything that you would want essentially to have access to potentially win. Yeah.
You're donating that?
Oh.
Lori, that's so generous.
All in favor?
She said when, and then I threw it in. I was going to make a request. I will make up something.
Pay the piper.
So if they donate, they're going to put like a little frame kind of acknowledging who it came from. And then the same thing for centerpieces. We're hoping those to be made by a micro business or an organization where it can have the actual consumers or person served participate in that in the same way. On each table, we would acknowledge their contributions.
Do you want to mention NAMI and everybody versus
Yeah, I
stigma?
think it's great. I could go on for like 2 hours on this, so I was trying to give a brief. But one of the other very exciting things we're doing as people leave, and we're going to make sure they stay. So everyone's getting the Everybody versus Stigma T-shirt. So we've already got that in the works, and then we're going to probably have some type of package that they're leaving with. So I point that out because we really want this to be an opportunity to celebrate the people who are providing the services, but also the people who are receiving the services. So again, if you haven't nominated anybody or if you think of any ideas, we really want this to be very, very nice for them, anybody who's participating.
Some of the nominations we've received are, I nominate Tracy because she's a good person. We need a little bit more than that. So when you spread the word about nominations, you know, there will be a committee reviewing those, so that the things that are personal, you know, a little emotional, heartfelt, would be great in order to recognize. We want to recognize and celebrate everybody because we know all the hard work that's going on out there every day. But this is a special opportunity to really, you know, recognize those outstanding individuals.
And we plan on honoring anybody who's nominated. They might not win, but there will be efforts to nominate for them to attend if they would like. And also, like on our website, they would be on the website for the next year. So it's not just going to be this one event. It's going to be a continuous for the next year until we have the next one.
Right. This is our first annual, so we want to keep it going. And
At the awards that the association gives, they have designated ones, but I know you're just gonna have across the board kind of things, but is the media included, people who cover our stories and,
So Amir Jacobson from CBS Detroit is actually our MC.
okay.
So we haven't confirmed the additional, but we can do a press release ahead of time, and we'll try to confirm with her that she's sharing this publicly outside of just being the MC.
Just if I could, going back to the previous, it does read that they will get a monthly invoice at the hourly rate per consultant hour with a not to exceed amount of total cost without prior approval from me. So we will be able to control the utilization.
Else on item B? All right, I have a motion and support. All in favor?
Aye.
Any opposed? Item 5C, request to move to CMH full board for final approval, issue an RFP for a lobbyist. I'll take a motion. Support Lori, thank you. Dave, is this one you?
This is, thank you. With all of the issues that have come up at the state level, it's just become more apparent. And then when I look at Oakland and Wayne, they have active lobbyists going on their behalf. When we tried to get our legislative event organized, we were, a little short-staffed on those efforts. But it is very much an important part of what I should be more involved with. So I'm looking to issue an RFP, see who's maybe like an RFI, but probably an RFP, to see who's interested in maybe trying to help us out, and then what's the best fit for the types of issues and needs that are coming up specific to Macomb. But again, connecting with the Macomb delegation and the governor and the people that Mark talks to all the time, that we need to be doing more of, I need to be doing more of. So the information flow, the guidance, and then the active participation more with our local delegation for sure.
Aye.
Any opposed? Request to move to CMH full board for final approval, consulting agreement with Prest and Associates.
Support.
You guys practice at home, don't you?
Yeah.
A motion by Lori Orsolina and support for Linda. Okay, Dave.
All right. So as we pursue our NCQA accreditation as a managed behavioral health organization, one of the requirements that I have asked a lot of questions about, but it's a firm requirement, that anytime a denial is made of any service for medical necessity purposes, a medical doctor has to make that determination. So we estimated at one time 200 to 300 of these a month, and yeah. And there is a kind of a per consult fee with Prest. Prest is a well-known review organization. They have a huge panel of clinicians, doctors with all the letters of the alphabet after their names in various specialties and things like this. And it's all remote. You send them a review packet, they review it, send it back. So we did follow up before bringing it to the board, and we do have 2 psychiatrists currently working with managed care operations. And we're working with IT and our vendor, PCE. The process would be that we would continue to have MCO staff review all, requests for services. But for those that they are suggesting a denial, including a reduction, we'll kind of make that easy as possible to go to our 2 psychiatrists currently working in MCO. And then we would be using Prest as an overflow. So if there was an increase, we've not been denying, many services right now, given the funding situation. But going forward with the ending of the public health emergency, and maybe if the general fund is cut, we're going to have to make more of those medical necessity. And as we become accredited and better at those medical necessity utilization decisions, it'll become a kind of a standard ongoing practice. So the intent of this contract is to use Prest, like I said, as a backup to our 2 psychiatrists, and then we'll be able to track the cost and report on that. But that would also give you an indication of the number of denials that are coming through and things like that. So.
Okay, thanks, Dave. Okay, we have a motion.
Aye.
Any opposed? Items A is
That was quick. The big news is our CARF accreditation survey started today. They're doing their exit Friday. Just a big thanks to all of our staff who really pulled together. We have some really good people in our quality department. We are minus a chief quality officer, but the team over there is really doing some very impressive work. Let's see, Tracy and I talked to them twice. Phil talked to them. Jeff Weefrich from MDHHS and as a funder spoke to them as well, and they're trying to connect to Lisa Lapine from the ARC and the Macomb County Provider Alliance as a referral source reference and things too. She did a touch base at the end of the day today on the administrative stuff, and overall very positive. We're some follow-up on some performance improvement projects that we'll be following up on. The quality staff also participated in the site reviews. So they were at our south location, the clinic, and our children's clinic, and the Verculen building today. And it's a virtual survey. So staff are literally going around with the camera and walking through and letting them, and they're doing all of their interviews with people served and everything else too, virtually. But the feedback there was that the staff did a phenomenal job. I will be at the Verculen building tomorrow morning. The Board of Commissioners are doing a tour. Minus Phil. But there's all of the programs there in the Verculen building, but our children's unit will be well represented, and we'll be able to share information with the commissioners as they walk through. And then Friday, there's the exit, and we'll be able to share the results of the survey and how we did. Just this afternoon, during the opening conference for our CARF accreditation, she mentioned that this was our time to brag. So I took that opportunity, and I had provided an update to this board about accomplishments since 2018. I used that as the base document, and then I provided updates on the stability payments and all of those types of things. And then I tweaked all of that together, and I gave her about a 10-page bragging document that I'll share with the board as well. But we've accomplished a lot. And I moved that one up to 2020, which was when the pandemic first started. So we have a lot to be thankful for. I know there's lots of work to be done, and we're well aware of that and making progress, but kind of good to have an outside person come in. And she was very impressed with our strategic planning process, that it's very active. It's not like I did a strategic plan and then I put it on the shelf and I look at it just before they come out again and things like that. But we'll have more good things to say on Friday. Thank you.